Good afternoon, everyone. Thank you for joining us for today's Talking Point. My name is Anna Guthrie and I'm an Educational Officer at Turning Point. Before I introduce our speaker, I'd like to acknowledge the traditional owners of the land and pay my respects to elders past, present and emerging. I'd also like to extend my respects to all Aboriginal and Torres Strait Islander people today. I'm really pleased today to be able to introduce Dr. Michael Savage as our guest speaker. Michael is a Senior Research Fellow at Monash University, and he's also the Strategic Lead of Clinical and Social Research at Turning Point. So Michael's research focuses on the social and cultural aspects of alcohol and other drug use and healthcare, and often draws on critical approaches and qualitative methods. Michael will be talking about the Hospo Drinking Cultures project that he's involved in. But before I hand over to him, please note that a live recording of this event will be up on the Turning Point website in a week's time, and also that Michael's slides will be emailed to anyone who registered after the webinar takes place. If you'd like to ask Michael a question, you'll note that the chat function is disabled, so you're not able to use the chat, but you can type your question into the Q&A. And any questions that you'd like to ask of Michael, we'll go through these at the end of the presentation. So that's enough from me. I'd like to hand you over to Dr. Michael Savage. And thanks so much, Michael, for presenting to us today.
Thanks so much, and I really appreciate that introduction, and thanks for having me here. I'd also like to echo the acknowledgement of country and acknowledge the traditional owners of the unceded lands on which we're gathering. I also pay my respects to elders past and present. As Anna said, I'm going to be talking about a project called Animating Alcohol Culture Change among Male Hospitality Workers, which, as the name suggests, aims to facilitate culture change through developing animated documentaries. Today, I'll provide a bit of background and present some of the research that informed the project before we watch one of the animations, and then reflect a bit on the development process and the potential of animations for culture change. This project involves quite an interdisciplinary team, including researchers from public health, drug studies and sociology from Monash, and hospitality training providers at the Chisholm Institute. Oh, and our excellent creative director, Isabel Knowles, who oversaw the development of the animations. And you'll see lots of Isabel and her team's illustrations and work throughout the presentation. And there's also a few more key people I'd like to acknowledge at the end. This project is funded by VicHealth as a culture change project through their Men's Risky Drinking Cultures initiative. And the initiative draws together two emerging focal points, which represents a bit of a shift and innovation from conventional public health thinking, I think. The first shift is an increased emphasis on drinking cultures. I guess the first thing to say about drinking cultures is that policymakers and academics are increasingly interested in them. As well as increased academic attention, policy documents increasingly refer to the need to change the drinking culture as a way of addressing problems associated with alcohol use, without really defining what drinking cultures are. And that's also true of Victoria's Alcohol Action Plan. Given the conceptual ambiguity, we pulled together bits and pieces of literature on drinking cultures and proposed the working definition you can see there on the screen. As you can see by the length of the definition, understanding drinking cultures is not so simple or straightforward. Thankfully, VicHealth proposed a shorter definition in their alcohol cultures framework, which some of you might be familiar with. They say that drinking cultures are about the way a group of people drink, including their shared understandings of formal rules, social norms and practices, values and beliefs around what is and what is not socially acceptable when people get together. Unlike traditional public health approaches, which often focus either on things like alcohol availability and price at the societal level, or on individual behaviour change, a drinking cultures perspective invites a focus on the dynamic and interconnected settings, skills, and shared meanings that materialise in social worlds around alcohol, while also keeping an eye on those broader societal factors and that individual level. So in our context, this provided an opportunity to focus on the occupational setting and social worlds of hospitality workers, which is a group of concern to public health bodies and a group we engaged with in a previous work led by Professor Steve Roberts. Another encouraging shift has been an increased focus on the role of masculinity in alcohol consumption and harms, which has pretty much been absent from public health conversations about alcohol, despite men's overrepresentation in alcohol harm statistics. This has spawned a whole VicHealth initiative to address and change men's risky drinking cultures, which rests on an idea of culture as changing and changeable. Unlike the view that culture is simply transmitted onto people, Hannah's here talked about culture in terms of networks of meaning that are continuously being renegotiated and reconstituted rather than only being transmitted. I think this is a really fruitful way of looking at culture, because it means that if norms and practices are always being renegotiated and reconstituted, then there's always an opportunity for them to be constituted in new or different ways. Which then brings me to the rather big question of how to facilitate culture change. I guess there is, of course, a question before that one about why and what needs to change, and embedded in that question are all sorts of assumptions about what the problem is or what the problem ought to be. And I'll touch on why we focus on hospitality drinking cultures shortly. So in addressing the question about levers for alcohol culture change, though, I'll turn to some insights from our Hospo Drinking Cultures project. As I mentioned, this project developed animated documentaries about how men are navigating and changing hospitality drinking cultures in order to facilitate low-risk drinking, alternative ways of winding down after a shift, and care between hospitality workers. So in the first stage of the project, we surveyed almost 300 hospitality workers and students, and then conducted qualitative interviews with 40 men to better understand hospitality drinking cultures and inform the development of the animations. Using a co-design process, we then invited 5 participants to be involved in animation interviews, the audio recordings of which we used as the narration in our 5 animated documentaries, developed by our creative director, Isabel Knowles, and her animation team. We've then been incorporating the animated documentaries into hospitality training and education at Chisholm Institute, which runs a number of hospitality courses, and are sharing them more broadly as part of the Culture Change campaign. But why did we focus on hospitality drinking cultures? So findings from our initial survey of hospitality students and workers provides a good idea. So this is who completed our survey, and I just wanted to emphasise that we invited people of all genders to participate in the survey, recognising the important insights that everyone could provide. We also had a good mix of students, workers, people with front of house experience, so waiters, bar staff, and back of house hospitality experience, so that's your chefs and others, which is important given that different drinking cultures are likely to be in operation in each of those settings. I must confess that I'm not a numbers person, so I've just pulled out a few key findings and presented them in probably a very unnumbers way. What everything you can see on the screen suggests is that, unsurprisingly, alcohol is relatively prominent in hospitality settings. So, for example, the majority of people thought that drinking within hospitality workplaces was more common compared to the average Australian workplace. And surprise, surprise, we found that males were more likely to drink and drink heavily than females. About a third of people reported that alcohol was always available for free after work, which is one element in the common practice of after work drinks amongst hospitality workers. Despite this, 2/3 were unaware of a policy on drinking at their hospitality workplace, and very few said that the topic of hospitality worker drinking was discussed as part of their hospitality course. So the story here kind of aligns with the public health concern about alcohol in hospitality, which underscores the rationale for our project. But it's a bit more complicated than that, and it's not all doom and gloom. Despite the apparent prominence of norms around alcohol in hospitality settings, hospitality students and workers also reported supportive shared skills, norms and meanings that might be seen as protective in relation to the emergence of harm. For example, the majority reported that alcohol was never available for free during work, and many had strong beliefs about the inappropriateness of drinking at work. They also reported that there are opportunities to socialise without alcohol as part of events and other occasions, illustrating strong norms around care and responsibility. Over 70% felt like it was part of their responsibility to help keep their colleagues and patrons drinking in check and call out inappropriate behaviour if they encountered it. Similarly, 76% wanted the topic of drinking among hospitality workers to be discussed as part of their hospitality courses. So taken together, this suggests that there's not only an appetite for alcohol culture change, but that many hospitality workers are living and doing the change. And this suggests that perhaps our role as part of the project wasn't so much to initiate or drive change, but to amplify the changes and supportive practices and norms that are already occurring amongst hospitality workers and students. But how and where can we amplify change? What themes and levers should our animations focus on? They were some of the questions we had as we kind of developed the animations. And again, I think our qualitative interviews with male hospitality students and workers provided some useful clues. So through our analysis of the qualitative data, we identified 6 potentially fruitful themes we could focus on in the animated documentaries, and I'll run through these now. I guess the first thing to say is that many participants really loved hospitality work, as well as being passionate about food and service. Many appreciated deep social bonds and connection that they had with their colleagues. And as Jamie discusses here, alcohol was sometimes a part of that too. And that's something we also couldn't ignore as part of the project. While hospitality work can be really rewarding, it can also be demanding, stressful, precarious, and undervalued. And the COVID-19 situation really made things tough, even tougher for a lot of hospitality workers. Tiago, who was a 33-year-old head chef, says, high-end kitchens are very, very stressful, not much money, lots of hours. Most kitchens, I think, even these days, probably start at about 8 o'clock in the morning and you work to 12 or maybe 1 a.m. It's not very sustainable. Back a few years ago, kitchen abuse was very strong. There was a lot of bullying. Chefs really get stressed and sometimes get quite aggressive. I think things are getting a lot better these days, which is good. The hours are getting better as well, I hear, but like I said, there was a lot of temper in the kitchen, very stressful. And front of house staff also talked about the demands of patrons, busy services and shifts, and the emotional and physical labour of cultivating hospitable, lively, fun atmospheres for patrons, which also took their toll. Challenging hospitality work, rhythms, conditions and environments can place a toll on physical and mental health, and also help to explain why practices like knock-off drinks become so valued. As Reese talks about here, lots of valued effects flow from after-work drinks, including relieving the stress and resolving the tension that arises through challenging work and shifts. It also generates connections and builds relationships with other staff. However, it is notable that staff are tasked with the work of dealing with the shit that hospitality work throws up, as Reese puts it. It makes me wonder if the shit wasn't present, or if hospitality work and workplaces were assembled differently in ways that were more hospitable to staff, whether after work drinks might become less salient. Similar to the survey data, men and masculinity were identified as particularly influential in hospitality drinking cultures. Here, Emmanuel highlights this as a problem and something he'd like to see changing, saying, Definitely there's a majority of men who are having drinks during a shift or would stay for long after. I mostly see men that are involved in pushing drinks onto other people like it's normal, but it shouldn't necessarily be the case. One of the things that can help change male hospitality drinking cultures in particular is role models and model workplaces. And we heard lots of examples of this. Paul here says, drinking is something that you've got to be conscious of as a senior staffer. I've always tried to control it to a certain extent. And actually, I've tried to get the guys to do something outside of work which didn't involve alcohol, whether it's go play football or go play golf or something accessible, cheap and fun. But Paul goes on to say that the hospitality industry is changing. There are a lot more workplaces offering more money, less hours, more kind of perks, and it's slowly becoming better. So hopefully it comes good and it becomes a bit more sustainable and more in line with every other industry. So given how entangled work conditions and environments are in drinking practices, like after work drinks, as we've seen, it makes sense that cultivating hospitable work environments and conditions for staff is likely to have a big impact on well-being and drinking practices. And again, this is something we didn't want to shy away from as part of the project, even if it's a big issue that the project may not be able to fully address. Role models were also important in normalising harm reduction strategies, and Martin illustrates this here well when he says, my first day at work, I said, I don't feel like drinking after work. And then the second day, my chef told me why he doesn't drink alcohol. And then I was actually like, oh, actually, it's a religious period for me. And then he was like, oh, that's fine. If you don't want to drink, don't drink. We have tea, we have lemonade, we have water. We're more than happy to accommodate you. Like, easy, well, what is this? And then made friends with everyone after. Similarly, others also talked about routinely providing staff with non-alcoholic beverage options, but also at staff events and celebrations where drinking were typically encouraged. In relation to this, Emmanuel says, I think putting every celebration immediately linked to alcohol is not good. Do you have to always be drinking when you're celebrating anything? I think like that should change a little bit. Another thing, depending on what venues do for their staff, if you have like non-alcoholic kombucha or like a good alternative for your staff, I reckon that should be an option. Alternative ways of winding down and connecting with colleagues other than drinking after a shift or on other occasions was also a strong theme. Martin exemplifies this here, saying, I don't always go to the pubs after work. I actually invite people to go to arcades or watch movies, because that way you can still form the same level of friendships just without alcohol. You don't need to have need a drink to make friends. You don't need a drink to have fun. You can still do other things, just anything that's more interactive. You form friendships. Like, hey, there's a million and one ways to have fun without alcohol. So Martin also talks about how entrenched alcohol is even when people are just starting out and learning their craft. And he says, I brought it up as well with my uni or his college where he's enrolled in a hospitality course. They said that we don't really teach students about alcohol. We teach them different ways to socialize, but we have parties where students get free alcohol. It would be beneficial if uni did talk about drinking habits and how we can change that. Reflecting the survey data, the interviews were also full of examples of people looking out for and taking care of each other and themselves. And we were keen to amplify this through the animations, as you can see there on the screen. But why use animations as a culture change tool, and how did we do this? Again, I think there's some clues that lie in our data. As Reese expresses here, hospitality workers were sceptical about paternalistic public health approaches that don't engage with people's complex experiences of drinking and the various settings, skills and meaning involved. I'm probably reading too much into this, but the sentiment that I don't think it's up to people individually potentially highlights a complex understanding of agency is not solely located in individuals, but distributed through bundles of various factors in which we might also consider the role of and intervening in work environments, and other things. Reese is inviting us to consider different approaches that engage with people's lived experiences, and animated documentaries might be one of those, although there's countless others. Animated documentaries are a form of storytelling, and as per Martin's revelation on the screen, sharing stories can facilitate connection and conversation. As Martin's account shows here, stories, conversations can do lots of things, including reflecting, amplifying, disrupting, and changing cultural norms. So he talks here about a conversation with a chef, his teachers who changed lots of things for him, and then how that had kind of springboarded into further conversations. And indeed, that insight is at the heart of several really great stigma reduction initiatives that draw on lived experience stories to humanise people, normalise their experiences, and offer other different ways of understanding these. The Belonging for It project was particularly inspirational and instructive for us, as it provides an example of a well-being focused animated documentary at work. It's basically a digital storytelling project where stories of methamphetamine use and intimacy amongst gay, bi, and queer men were animated to reinforce norms around caring and connection and stimulate conversation. Definitely one to check out if you haven't already. I suppose we often think of animation in terms of the last definition on the screen as synonymous with TV, film, and video games. But I think some of its other meanings are also relevant in the context of culture change or public health projects. For instance, to animate culture change amongst the social world is to stir the social world to action, to motivate, embolden, and encourage it, to bring the change into motion, to make it lively, to amplify it, as we're trying to do here with this project. And indeed, there's a growing recognition of the potential usefulness of animation for public health efforts in the scholarly literature too. This really emphasises that animation can be engaging, well received, and sensitive to representation, and can enable rich depictions of complicated, emotional, and challenging experiences and topics. Okay, that's enough talking about animation for me for now. Let's have a look at one of the 5 animated documentaries that we developed as part of the project. This is Jamie, a 29-year-old manager at a cocktail bar and restaurant with many years of hospitality experience. The video goes for about 3 minutes, and then I'll reflect on some of the learnings from the development process. So I'll click on the video now, and hopefully you can all hear it.
At the time, I didn't see any problem with it. I thought it was great. I thought I had the best job in the world. Got to go to work, drink with a bunch of people that I really enjoyed hanging out with, and then go out and kick on with them. It's always around. I've never been in a venue where people don't drink. So if everyone's drinking, you're like, oh, well, I guess I'll drink too. It's kind of hard to escape it. We went out for a hospitality staff party, and the dishy didn't really drink much, and he was trying to make good choices, trying to order pots instead of pints, but whenever, someone come over and goes, oh, a pot, someone else would go, oh, we'll get him a pint. And then that kept happening. And then we went to another venue and we'll drink cocktails. And then he goes, oh, I don't want one. And he'd get one anyway. So instead of ordering 4, we'd get 5, and he'd have an extra one. So he just kept ending up with a drink that he didn't necessarily want in front of him. And, we were all sitting around and drinking and enjoying ourselves. He just drank them, and he kept drinking them. And then, he drank too much, and we ended up having to call an ambulance for him because he was just so intoxicated. We couldn't figure out what to do with him, which was a bit sad. And he's just such a sweet dude as well, which is the worst bit. I feel like I should have stood up more because I was in a more managerial position at that time. I should have been like, nah, he doesn't want a pint, don't get him one. But I was like, well, he's an adult, he can make his own decisions. But that peer pressure kind of forced him not to make his own decisions. So I had this manager super nice guy, and we were kind of involved in that culture together, drinking. He, kind of made that decision. We were all still allowed to drink, but he kind of didn't do it, so we all looked at him and went, oh, well, ran it in. And then eventually just none of us did it anymore. And that's when we kind of started going out and doing other stuff. It's amazing how not drinking frees up more time for other stuff. As a 10-person staff team, there were 7 of us and we all surfed. So we'd regularly go out and surf because we had the days off. We could go down the coast, we could go wherever we want. And it was really nice to spend that time with my co-workers not drinking. But it's kind of hard. Sometimes you just don't find those interactions. Not everyone likes surfing, or not everyone likes, playing music, or not everyone likes going rock climbing or hiking or blah, blah, blah. So the common thing is like drinking. So you drink together. I was working with that manager and we had this massive function. Everyone was smashed. And he said, you don't like dealing with drunk people, but that's how you behave when you're drunk. I kind of just took a step back and I was just like, well, that's really shitty. I don't want to behave like that. I don't want to act like that. And the culture just, for me at least, kind of really changed. Something that really helped me is I used to go out and we'd always get rounds of shots. And I was like, why am I drinking shots? Oh, to get more drunk. But that's not the point. I'm here to enjoy myself and socialise. If I have 5 shots and 5 pints, that's 20 standard drinks. I'm cactus. It took me a lot of time to figure out what's a healthy amount to drink. Where do I draw the line? You just really need to think about what you're doing.
Thanks. I hope you were able to see that all okay. So I guess a lot of work went into developing each of the animations, and I just wanted to share a few learnings from the animation development process that may be useful to others. So each animation interview was about an hour long, but we wanted each animation to be about 3 minutes long to maximize engagement. So there was a mountain of content and thousands of possibilities for what we could include, both in terms of audio and visuals. This means that means making lots of decisions, which can be overwhelming, but here are a few things that helped us. I suppose it was useful to have a pretty good sense of what themes to focus on, and we were lucky to base this on our consultation and research with hospitality workers and students. And also important to have a clear idea what you're looking to achieve, and as well as how you want to say things. So for us, we wanted the animations to be positively framed, and we were also lucky to have the VicHealth messaging guide to help us. Having an excellent animator or creative director was critical. Recognizing that we as researchers are not animators, we leaned heavily on the expertise of and trusted in our creative team. It was useful to meet with and involve the creative director early on in the process, and then regularly as the animation work was developing. This helped us make decisions about the style and content, not only based on what is thematically on point from our culture's perspective, but also in terms of what is engaging and interesting and works from a storytelling and animation perspective. And sometimes the dual imperatives of informing and entertaining doesn't always sit so easily together, so some compromises needed to be made. It's a bit of a buzzword at the moment, but co-design and feedback and fresh eyes were also important. Feedback and input from stakeholders, especially hospitality workers at all stages, ensured that animations resonate with hospitality workers and students. For us, this also meant not completely ignoring people's experiences of pleasure and social connection through drinking, and I think if we ignored that, we risked losing people. Co-design and feedback can also help, but not guarantee with serious consideration of representation. So this involves thinking critically about how the decisions we make were framing the problem and solution, people and their experiences. So for instance, we tried not to just include content that trades in ideas of individual responsibility or blame, that just the sort of just say no sort of stuff when workplaces and a range of other elements are involved in hospitality drinking cultures. It also meant respecting participants' preferences for how they wanted to be depicted, including what they looked like, their name, and what they wore. For instance, Martin, pictured here, wanted a religious bracelet he wore to be included as part of his animation, and so we added that in. So I guess the last part of the presentation is really about how people have responded to the animations. And we did some reaction testing with 30 hospitality students and workers, where the participants watched each animation and then completed a survey. As you can see on the screen, some preliminary analysis has shown the reaction has been positive, with lots of people thinking that the information is useful and desirable to include in Hospo courses, and that they would share the animations with other people working in hospitality. And on the flip side, not to a minority thinking that they were judgmental or insensitive, which is good. The animations also stimulated thought about drinking and work, which was encouraging. And participants also reported that they're more likely to speak about the animations and their drinking, which was also nice to see. The qualitative comments were also quite positive, with people remarking on the engaging nature of the animations, and you can see those there in pink, and their usefulness in green bubbles there. There are also a few comments about potential unintended consequences or interpretations around the animations reinforcing or potentially reinforcing or glorifying drinking, which is something that all campaigns, I guess, need to take note of and care about. And we had a great suggestion about future work that draws more on the experiences of women in hospitality. So that's important for lots of reasons, not least of which is that everyone is impacted by masculinity. And as one participant said, hospitality is one of the few industries that has a reasonably even split in workers' genders. So something for hopefully a future project to think about. So what have we been doing? We've been sharing the animations and website content via an online campaign, which you may have seen, and that's been getting lots of traction and love, which is great. And with our colleagues at Chisholm, we've also been embedding the animations into Chisholm's hospitality courses, so students can engage with them and hopefully bring some of the insights into their work and workplaces, and I guess for the efforts of the projects to endure beyond the project period. In case you'd like more information, or would like to get involved, please visit the website, share the animation, get in touch if you'd like to use the animated documentaries in your work, and you can check out some of the great work in the space from other Hospo organisations and workplace wellbeing programs in general. So what do we make of all this? Well, I think we can say that alcohol is prominent in hospitality work settings, and practices like after work drinks arise partly because of the demands of hospitality work. But there are also shared skills, norms, practices and meanings that might be protective in relation to the emergence of harm. Although further research on the impact is needed, I think we can say that animations may be useful ways of engaging male hospitality workers in alcohol culture change. And although not guaranteed, they have the potential to resonate with people's complex lived experiences of alcohol use and work. I think involving target populations in the process of developing culture change or any public health initiative is a no-brainer. Often, as we've seen today, people are already living and doing change. So it would be unwise and I think ill-fated even to ignore this. I think our role as researchers and practitioners might be more fruitfully reimagined as amplifying and supporting change rather than driving it. I think it's a big task, but cultivating hospitable work conditions and environments for staff is essential to well-being and alcohol culture change in hospital and lots of workplace settings. So I don't think we can forget that. I think I might leave it there, but there's also a useful VicHealth guide that people might like to check out in terms of some tips and suggestions for like cultivating culture change and for culture change projects. And finally, I'd just like to thank everyone involved in the project, and especially the participants who generously shared their stories, experiences, and feedback. Also, I'd really like to acknowledge the support of Kelly Rutherford and the media and communications team, along with the website development team, all of which have been really crucial in disseminating the project outputs. And thank you all for listening and for tuning in. And I think I'll leave it there. But welcome to.
Thanks, Michael. That was wonderful. I'd like to reiterate what one of your animation respondents said. It was very attention-grabbing and interesting, and the graphics and the animation are wonderful. Now, remember, everybody, you still have a chance to ask Michael questions by using the Q&A function. So we'll see if anything comes through there. But Michael, if you don't mind, I had a couple of questions myself. So you did, you mentioned that kind of 90% of the people that looked at the animations and responded to your questionnaire wanted to see them included in hospitality courses. And obviously you mentioned the relationship with Chisholm and the fact that they have started to use the videos. Can you see any other opportunities to use the animations in hospitality worker training?
Yeah, thanks, Anna. That's a great question, and I think there's a really great opportunity for these animations and for embedding this sort of thing in hospitality training across various settings. I think lots of hospitality courses and training has components about professional practice, worker well-being, responsible service of alcohol, and I think they're all places in curricula and in training content where this sort of information could be useful, and kind of turning, flipping things around, and also thinking about not only how about responsible service of alcohol, for example, to patrons, but also what that might look like in terms of hospitality, worker well-being, and alcohol consumption. So I think at Chisholm they're very keen to and excited by the animations and keen to embed them in their courses. So I think the other thing is that their animations are they're fairly short and engaging. We're developing some questions that can be prompts that can be used in training resources to kind of facilitate some conversation around culture change and alcohol cultures. So I think that'll be useful, and we'd be really keen to hear from other, hospitality organisations, training institutes, and so on, if they would like to use the animations or can see any fruitful avenues for using them. We'd be really keen to share them.
Yeah, great. Okay. Another thing that you mentioned that struck me as interesting was that you said early on in the presentation that there can be kind of different drinking cultures within the actual hospo setting. So, for instance, the chefs might be drinking differently to the front of bar staff. Can you talk us through a little bit more about that if you learned anything more, and also whether there might be different cultures, drinking cultures that exist perhaps in cafes versus bars versus large venues versus smaller venues, that kind of thing?
Yeah, that's a great question, Anna. And I think we noted lots of diversity in practices and norms across different settings and groups, and I guess that's another key point about the alcohol culture stuff too, is that even within a supposed social world or group, there are lots of sub-social worlds and groups with different norms and cultures. And I guess a really clear one of the places where that's kind of often most distinct is, I guess, the practice of after work drinks. Some of the participants that worked in sort of cafe settings and or in sort of rural or regional areas, for example, talked about that, they would often finish a shift and go home. That they're probably the after work drinks wasn't as big a thing, and there weren't the opportunities to engage in that, which in some ways what was might from an alcohol culture change perspective be protective, but it also left some participants talked about not having an avenue to de-stress and compress after what are still challenging shifts and environments, and I suppose that's where some of those alternative activities for winding down that the project talked about could also be useful. We also kind of noted a bit of a difference, even in whether, I guess, knockoff drinks sometimes might be 1 or 2 drinks after a shift, and for some of the chefs in some workplaces, they talked about that beginning as soon as part of the pack up process as they're packing down. Whereas and that the knockoffs sometimes could materialize into sort of lock-ins or huge kind of nights, and that the opportunity and that where that was often more prominent was in sort of where people were working late shifts, where they wanted to socialize after a shift, but all their friends may have been sleeping or doing other things, and so opportunities to do that weren't always available. And some workplace cultures were such that you can stay around in the venue and continue to drink. And I guess the other thing is that I suppose we also noted a bit of a difference between like big hospitality organisations and chains, things like the catering at the MCG, and compared to sort of small bars and venues where there may maybe not always, but maybe looser kind of norms and restrictions around alcohol and workplace policies and stuff like that. So I think that's a long response to that question, Anna, but I think the key takeaway is that we do need more tailored approaches to culture change that target each of those groups, and through the animations we've tried to illustrate some of those differences and so that they resonate with all of the groups, but it's also tricky in that kind of 3-minute time slot to do that, but definitely something to keep looking at.
Yeah, great. Thanks, Michael. Joe actually asked a question that bears some relevance to this too. Thank you, Michael, for your very interesting presentation. I work in AOD prevention and I can see how this would be very valuable in hospitality training, but do you have any thoughts about how we might be best able to promote this to employers?
Yeah, that's a great question, Joe. Thanks for that. That's excellent. I mean, yeah, I suppose this is one of the big the conundrums, I suppose, is that we can try and facilitate culture change from the bottom up, I suppose, and get people going into workplaces and transitioning into the workforce with all these great ideas and norms and supportive cultures. But then I guess the moment that they step into workplace settings, if the cultures there are quite different, then the degree to which all the efforts at that early stage might erode, or how that, and I suppose there are power differentials in workplaces as well, where I might not want to, as a junior staffer, might not want to drink too much, but I'm also like the youngest one there or a junior staff member, and I feel like I need to sort of to get on board with what my colleagues are doing. So I think engaging workplaces, managers is critical. The question of how we do that is I think still an open one. We've been trying to engage them in the conversation around this right from the get-go, and though lots of hospital organisations were really keen to be involved and supported and the project and spreading the word. So I think that's a good step. I think as many of the animation shows, senior staff and managers were also key in creating some of those changes. And there's a real groundswell in hospitality, as in other industries, of managers and role models, taking the charge. And there are now a number of hospo wellbeing organisations and that are kind of advocating for changes in this space. So I think it's crucial, but I think there's still more work to be done. I'd be keen to hear any thoughts you have, Joe, or anyone about how we do that.
Great. I was also reflecting, Michael, on how, the worker survey respondents said that, they don't agree with free drinks during work hours. Did you get any sense of how many workplaces kind of offered free drinks at knockoff, and whether that was a big part of the drinking culture?
Yes. I guess well, I'm not sure if I can remember the statistic, but it was much more common, and especially in those settings where the smaller venues as well, and settings where there is a culture around that. I think it's kind of, in some ways, it's one of the unfortunate things about, I guess, sort of the pay in hospitality is sometimes that alcohol is seen as a way in which employers or managers might give a little bit extra, but it means that instead of paying people for the great work that they do in a commensurate way, they may be relying on these other perks, I suppose, which is a sort of problem across the industry and other industries as well.
Yeah, for sure. One last question that came through was, you talked about the benefits of animations for public health campaigns, and showed some of those other public health campaigns that you guys had sort of used to inform this particular project. Can you think where there might be any sort of risks or limitations to using animations in public health campaigns?
Yeah, I think that's a great question, Anna. And I think, one of the things I think I would say is that, animations, any project like ours is just a very small, ours is a very tiny piece of the puzzle. It's not a panacea. It's not going to fix workplace conditions or some of those bigger factors that are going to that are important to address alongside animation. But I think it can draw attention and foreground some issues. So I think one of the things is that if we think animations or anything is the only thing, then I think that's quite limited, and that's gonna. I think that's not going to be. That's not where our maximum impact is going to be. I also think, animations, because of the fact that often they need to be short to engage people. So there is an element of sometimes an element of simplification that happens. We can't present all the information in a sort of complex way. So there is a risk that some things that are oversimplified, and we're missing out on some of that complexity. And I think. I think so. I think there are a few things. I think some there can be a sense that animations are maybe maybe a bit of a novelty thing. That there are associations with animation about children's stories, or it's something we watched after school as kids or whatever. But I think that view is rapidly changing, and animation, is lots of different ways, is reaching all sorts of different audiences. So but I think there are a few things that spring to mind, but other people might be able to think of others as well.
Thanks, Michael. Okay, well, it doesn't look like we've got any other questions that have come through. I just wanted to remind everybody that Michael's slides will be sent out to you later after this presentation concludes, and that you're welcome to get in touch with him if you have any other questions or you wanted to know more about the project. But other than that, I'd just like to thank you again, Michael, for what was a really fantastic presentation, and can't wait to see a bit more work done in this space in the future.
Thanks, Anna. Thanks, everyone. Really appreciate it.
Great. Okay. Thanks, everyone.